Hi, everybody, and thank you for taking the time today to join this webinar. We are going to be covering chronic care management and the partnership between Amazing Charts and CareMerge today. My name is Adam Lombardi. I am the Director of Sales and Business Development here at Amazing Charts, and I'm going to be providing you guys with an introduction, and then I'm going to be passing controls along to two other people. First, you will hear from, I believe, is going to be Michael Knipper, and Michael is the strategic account manager at CareMerge, basically staying up on the new regulations and working with clients to get them as efficient as possible. And then today we are lucky to have Bonnie Rolls joining us as well. She is actually a dedicated care coordinator for one of our practices that is pursuing the CCM incentives that are on the table now through Medicare. So to dive into a little bit of the history behind Amazing Charts, chronic care management, and CareMerge. A little over a year ago, closer to a year and a half now, we started researching possible partners to work with in assisting our clients to earn this extra incentive that was out through Medicare. And there were a lot of companies that were starting to get involved with chronic care management. We actually researched about 12 companies, went through product demos, looked at their prior success rate over the previous 6 months since the program had been started. And after all of that vetting, we felt that CareMerge was the best fit for our client base. From there, we've started development on integration with an interface that will allow information to pass somewhat seamlessly between the two platforms, which of course will eliminate a lot of double entry and make this work a lot more efficient at your process. We chose this time to work exclusively with one company. In the past, some of our offerings, we've worked with several, and we've offered our community the chance to try and find the one that was the best fit for them. In doing that, we learned that it wasn't always the best approach because there was competition between teammates, which is never going to build a healthy relationship with partnerships. So we decided this time to make it a team effort and just choose the one company that seemed like they would deliver the level of service that we were used to delivering and that our clients would expect. So with that, I'm going to pass this along to Michael Knipper. He'll be able to go over some of the basics of the chronic care management program for you, and then he'll pass it along to Bonnie.
Adam, thank you for the introduction, and I'd like to thank you, Bonnie, for your time and participation on today's webinar as well.
With that said, good to be here.
Great. With that said, let's start off and dive right in. What specifically about the chronic care management program appealed to your practice?
Well, I think basically because I'm a certified case manager by trade, as well as some of the past things that I've done in my career, such as the past administrator of several practices, managed several practices, and having home care as well as, and also being a private consultant, having my own case management business. I just looked at the application and I thought chronic care management, the program itself, was such a good fit for any practice. You know, chronic care management is really a team-based model of care. It's designed to not only improve the coordination of the patient's health and overall well-being, but to have the patient involved in their decisions for their health care and their lifestyle. And by doing this, you give them the opportunity to be in control of their own health care, thereby increasing their compliance, which, you know, sometimes can be a challenge in a practice. I think the other thing that was, I felt it was long overdue, and so I was really excited to see Medicare start reimbursing practices for this particular service. The CPT code 99490 for the chronic care management code was really long overdue. You know, larger insurance companies such as Blue Cross, who I happened to work for in the past as well, and through one of my career choices, as well as United Healthcare, they've had operations similar to the CCM program for a long time because it significantly increased the patient's health and particularly cut their cost, which is, of course, we all know that's the name of the game anymore. Medicare was reticent regarding those changes for the Medicare population, and because we all know Medicare is usually way behind the 8 ball when it comes to sometimes providing comprehensive preventative programs to their aging patients. So it was great that CMS sees the benefits. This all really appealed to me, especially the fact that they're increasing revenues to the practices come January 2017 for this program. Medicare recognizes the benefit of this for the practices, that we are spending extra time with those higher risk patients. And I know Michael will talk a little bit about this later.
Thank you, Bonnie. And do you consider the chronic care management program integral to patient care and engagement?
Absolutely. You know, we catch things all the time because of our program. Gosh, I can give you so many examples. For example, I had a patient the other day. We put them on an antihypertensive medication, and what happened was they went to a neurologist, and they were given another medication on top of that medication. And when I reached out to them through my normal monthly chats with them, I found out that they were confused. Instead of adding the medication, they just deleted the first one we gave them, and they were wondering why their blood pressure kept going up. So I think the benefit to the patient is immeasurable. Patients are always confused sometimes about doctor's orders, and I think that sharing these type of things, that's why it's so important for our patient care, is that we share the positive stories with our physicians all the time, and that really completes the circle of communication to ensure everyone's on the same page for the best interest of the patient. And we all know that better care and better outcomes keeps the patients out of the emergency room and the hospital overall, and we can't always do that, but we sure can prevent a lot of things.
That is a great example and the essence behind the chronic care management program. Let me ask you, Bonnie, I'm sure you did your homework when finding a new solution. Can you talk about why you chose CareMerge, Amazing Charts, and what that experience has been like as a client?
Sure. Well, the application was really chosen by our medical director, Dr. Call, and the office manager. They had seen the presentation such as the one we're doing now, were very interested in it, and had gotten with CareMerge. They both felt the program would be beneficial to the patient and also drive additional revenue into the practice, certainly two key elements for most practices. I really did not get involved until I happened to be turning in my resume for the practice shortly after they looked at the program, and they saw that my credentials might be a terrific fit for them. So they had really decided to hire me for that program, and I've had the pleasure of starting the program and building out the program from ground up. So that was a little bit about how it started.
Thank you very much. I want to touch now on some of the implementation questions after you had decided to move forward with the CareMerge platform. What was implementation like at the start?
Well, gosh, I was surprised it was as easy as it was. I worked with Courtney from CareMerge for the training. It was truly not very long at all. The training was quite simplistic. Not the training, but the application is so simplistic. I don't really remember anything specific about the training because it was so quick and short, and it was such an easy application to learn. It was basically, turnkey, but I also think that the tutorials that CareMerge has created to help the clients were beneficial as well, Michael.
Thank you. And the initial training, was that was less than an hour, correct?
Yeah, yes, it was. I mean, it was, very quick. It's an easy application to learn and pretty user-friendly. If anyone uses Amazing Charts, you're not going to have one bit of problems with it at all. It was enough to get going, and certainly yourself, Michael, and Courtney were very helpful when I needed some questions answered when you first get started. There are always some minor detail questions, and you guys were great in meeting my needs, so the training was pretty seamless.
Thank you again, Bonnie. Before we get into the nitty-gritty of chronic care management, I'd like to briefly talk about the recent macro ruling and how it's going to affect your practice and others similar to yours. So the final ruling addresses the quality payment program, and that's going to focus on quality of care, care improvement, and value-based care. MIPS is going to be for providers that are in traditional fee-for-service Medicare and providers who bill Medicare more than $30,000 a year and also provide care for at least 100 Medicare patients annually would qualify. The provider can choose to start any time between January 1st of 2017 and October 2nd of 2017, and performance data must be submitted to CMS no later than March 31st of 2018. MIPS is going to phase out 3 CMS programs: Meaningful Use, PQRS, and the Value-Based Payment Modifier. During 2017, quality data would be recorded and how you use technology to support your practice. Payment adjustments will be based on performance in relation to quality and value. To potentially earn a positive payment adjustment under MIPS, the provider would send in data about the care you provided and how your practice used technology by the deadline of March 31st of 2018. We have a chart up here that is going to show the potential ramifications going in 2019 forward. And as you see, it's a plus or minus reimbursement of starting in 4%, and looks like it's rising to as high as 9% plus or minus in 2022. So what is the feedback from your practice, Bonnie, now that chronic care management has been mentioned as one of the quality measures?
Well, I see it as a huge benefit for our practice. And to me personally, and from what I've seen doing the program so far for about 5.5 months now, that it demonstrates and validates Medicare's commitment to CCM. We know that that's happening because of the increase in reimbursement rates, which I know you're going to talk about a little bit later.
Thank you, Bonnie. We're going to talk on a different topic, some CCM solution questions. Can you let me know how CCM helps you reach your practice goals for patient care and revenue?
Right, and it's exactly those 2 ways. Our first goal is obviously to increase care for our patients and to increase the preventative care for our patients. And really that's, I think, why CCM was developed by Medicare, to keep our patients healthier and living longer, and we certainly do that through the chronic care management program. Second of all, I think it's the increasing the revenues is most important. As we know, Medicare and the other private insurers have really cut reimbursement rates over the years, and CCM, Chronic Care Management, acts as an adjunct supplement to make up for those lost rates over the years, and still recognizing the importance of care coordination and how it relates to patient-positive outcomes. It not only increases communication with the patient, that communication allows us to really intervene more readily and more quickly to keep the patient out of the hospital, out of the emergency room. It creates a lot of goodwill with the patients. Oh my gosh, they think it's wonderful. And we get lots of positive feedback. Patients are regularly telling their providers how much they love the program when we contact them on a monthly basis, be it for a medication refill, challenged for coordination with their specialists, if they're seeing another physician such as a urology consult, a neurology consult. It's a way to really build rapport with our patients and prevent them from going to a competitor. We know that we're a large family practice here on the island, on a couple of islands here in the U.S. Virgins, but the competition exists everywhere, and it's even worse stateside in very large cities. So you all are aware that whatever can set you apart is very, 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 very helpful for your practice.
That is a very important point, Bonnie. Thank you for that. And do you find that this has resulted in new patients signing up specifically for the chronic care management program with your practice?
Yes. It's funny because we'll sign up a wife or a husband, and they'll immediately say, oh, my husband needs to be on this, or my wife needs to come talk with you, or they tell their friends about it. I've had a patient sit in the waiting room waiting to speak to me because they wanted to find out more about the program. So it's really been very positive feedback for us. And it's important to clarify our role here in our location is because, and so many of you who may be listening have snowbirds that come into your practice. Many of our patients actually have primary care physicians back stateside. They're here for 6 months a year. They're back in their normal stateside location. And before we enroll them in Red Hook family practice for the chronic care management program, I always let them know that that's what the program is really about, to case coordinate with their primary care doctor if they have one back in the States. Usually they have one back wherever they're located and back here if they're not full-time on island, and really focus on coordinating that care and communicating that across all the different silos that we know exist in the medical arena, because you know, when the patients see specialists, things get lost in transit sometimes. So it's also very important to note that chronic care management really does more than just reimburse the practices for the 20 minutes of care coordination, non-face-to-face time during the month. We drive a lot of additional visits because of that. When I contact a patient on a monthly basis, or they call me for something else, I determine if they need to have a visit. And I'll give you a prime example. Just this morning, I had one of my chronic care management patients call me. We had just seen her 4 or 5 days ago, and she felt she was getting worse. Although I'm not so sure she was, but to increase her comfort level, we brought her in for another visit today, later in the afternoon, just to ease her anxiety. So there are a lot of additional benefits for chronic care and case management for these patients for the practice revenue. They like the access. You know, patients tell their friends, I have my own chronic care manager. And like I said, a lot of the bigger insurers out there have had this for quite some time. And as a result, this has resulted in patient referrals. I think one of the other interesting things is as you develop rapport with your patients, you really find out that they're utilizing our knowledge base to help them navigate the system for reimbursement as well as just health care. I had a patient call me the other day, and he was concerned. If he had gotten 90-day refill, which is the mail order for his prescriptions, he would have fallen into the donut hole for Medicare. So we quickly rectified that and gave him a 30-day supply until the new year. So there are things like that that the patients can rely upon you for, because it is a case coordination and a care management program for that patient. And I think the other benefit is the educational component. So important. We, as providers, sometimes forget that our patients don't always remember things we tell them. You know, sometimes it's a medication change or they get confused. We give them information on diet or healthier eating habits, printing out lists and better food choices. And I think the CCM program gives us the opportunity to do just that, to do those things and provide additional education for our patients. But I think the last thing I'd like to talk about, Michael, is the flexibility of the program. You and your practice can create it, what's going to work best for your practice. And I think that's a real benefit, utilizing the application and utilize your own staff to create how you would like it set up for your practice.
Thank you, Bonnie. Those are some great points that you addressed. I'd like to ask now what you feel some of the top aspects of the application itself.
Well, let's see. It's very simple to use. It's a simple application. It doesn't take long to learn or enter the information. And I love the care plans. You know, part of the requirement for the chronic care management program, Medicare requires that we do create a care plan. And it is so simple because there are templates that are already established by CareMerge. You have the opportunity, if you'd like to go in and change any of those original templates or create new ones, you have that capability. And what's amazing to me, and you know, we in the healthcare field, especially RNs by trade and healthcare professionals. They're used to having care plans, but nobody really looks at them. But these people are really reading them. That kind of surprised me. I'm really pleased with the whole application. It's very user-friendly, and I tend to move pretty quickly, so I like the speed of the application. It makes entering the data much quicker for me.
That's great. Before we move on to the next question, Bonnie, I'd like to address the new CCM codes that are going to go into effect January 2017, which is right around the corner.
Okay.
So I'm bringing up a few new codes. These were not in place in 2015 and 2016, but CMS sees the benefits of the program, and they're really making an aggressive effort to move forward, make it more beneficial for the practice as well. So we have a few codes here that I'm going to go into detail on the next slides. We have the G0506, the 99487, and the 99489. So in relation to the first code, G0506, this is when the patient comes into the practice and a face-to-face introduction occurs. The billing practitioner would speak to the patient with regard to the program, discuss the benefits of chronic care management, make an assessment, and discuss the care plan problems. So all the diagnoses with respect to that specific patient would be discussed during a visit in 2017, starting in January. So this is going to be billed separately with the initiating visit as an add-on code. So for whatever reason the patient comes in next year, you will now be able to bill for this. Previously, 2015 and 2016, this was not a billable event. You signed the patient up for chronic care management, and then it just began. The care planning could be face-to-face and or non-face-to-face, but it will be discussed while the patient is physically located in the office. Another important point I'd like to address, chronic care management in the previous years had to be initiated by the billing practitioner during one of either the comprehensive EM visit, an annual wellness visit, or IPPE. Starting in January 1st, it is not required any longer. Only for new patients or patients that have not been seen within the previous 12 months prior to commencement of chronic care management. So they're also looking to ease some of the burdens and comments that were in place prior to 2017. The new code 99487, this is actually in place today for some private insurers, but for CMS and Medicare. Previously, if those who are not aware, the CPT code 99490 was for patients that had 20 or more minutes in a calendar month. It did not matter how many minutes over 20, it was just one flat time frame. So now for your complex chronic care patients, those that are 60 minutes or more, the practice is now able to submit this new code and get a higher reimbursement rate. I was always asked previously, Mike, 20 minutes or more, can I do in increments of 20? The answer was always no. But if you do have a handful of those patients that exceed 59 minutes, you're now able to bill this code instead of the 99490. Same requirements that are in the previous code with the multiple two or more conditions, etc. So for those patients also that you have that are 89 minutes or more, that you would have each additional 30 minutes, there's an add-on code, which is 99489. Again, each practice might have a handful of these on a given month. Previously, if you spent 120, 150 minutes, it was just the flat 99490 code, but now they're taking into account the additional time that the practice and the certified clinical staff would take place. So often, Bonnie, a lot of physicians ask us about patient enrollment and what they can expect. I know what I tell them is that this is really not an issue to be concerned with, and an extremely high percentage of patients are signing up for the program. We're finding no pushback from patients once they hear the benefits of proactive care. but I know they'd rather hear it from a practice similar to theirs on what patient reaction and enrollment was like. So, Bonnie, could you please tell me what your experience has been like with patient enrollment?
Absolutely. I think you might, there's the slide. We've not had any barrier really in this regard. The first month, and when we started in July, I think we had 57 patients sign up, and incrementally has increased every month, which is incredible, really, because I think we find there's no pushback from the patients at all once they hear the benefits of proactive care. Now, there are always going to be some that choose not to do that. They feel they can manage themselves, and that's their right as a patient. Or some that we would love to have in the program, but they don't have the two qualifying conditions of chronic conditions. They only have one. And of course, the two are required by Medicare. But we've not had any barriers at all. We come up with a system for enrollment. Marketing is always a key important part of your practice. And so there's two ways that we do that. First of all, when we started the program, the local newspaper here did an article on myself introducing the program and what the benefits are for the patients. And that was incredible because I had people walk into the office and wanted to speak with me about it. Tell me more about the program, and told them they would have to make an appointment to do that, in which they did. But I think the other thing is that when we've set up a policy or a practice in our family practice, that when the patient checks in at the front desk and they are a Medicare patient, whether they're enrolled or not, because the front desk cannot keep track of all of that, we attach to their little super bill, because we are electronic, of course, but we do have a super bill for the patients. We give them a welcome Medicare patients to our chronic care management program handout. This is on the chart. When the nurse rooms the patient, we give them that, and it states basically what our goals are for you for the practice, what basically is the CCM program, just a bullet point, one sheet paper, how you can sign up, talk with your provider today during your visit, sign our consent form. So they read this when they're in the rooms waiting for the physician. So it's a good way to build the enrollment. Then the provider goes in the room and asks them about that, and they can bring it up themselves. So there are other ways that we do that. We check the daily schedules for any Medicare patients, and we label it CCM eval. In other words, provider, here's a heads up. They may be in for a left knee pain, but also check them for CCM evaluation and see if they qualify for the program. So there's ways internally as well as externally to go ahead and drive the enrollment. We really don't see barriers at all. The system's been pretty successful. In fact, so much so that we are now bringing on another part-time person because we want to increase our growth. Since I'm the only dedicated person at this point for the program, and we'll talk a little bit more about that in a moment. But well, some of you may ask, well, how many of your participants do you actually contact every month for the 20 minutes? And you can see by this slide, it's quite a bit because of our model. There are several ways your practice can set this program up. Our model happens to be a dedicated individual, such as myself, that oversees the program, coordinates everything. If I don't get enough calls or feedback from the providers during the month, say they spoke to a patient about their lab results, or one of the nurses called them about their prescription refills, one of the other nurses in the practice, then I can capture those moments as part of the 20 minutes. But if not, then I'll reach out to them and call them myself and get an update as to what's going on with them. So that is another way. That's one model to use. Other people don't have dedicated practices. They may not have the volume because we have 3 offices and we have 10 providers on staff here. And so they may use just their routine staff. And Michael, I think you can talk a little bit about that. Can't you not, basically, on what other models might look like?
Yeah, that's correct, Bonnie. So practices that don't have a dedicated care coordinator such as Bonnie, we are finding that the staff is providing a team effort where you would have one or two people that is really in charge and overseeing it, but it is a team effort where the practice and everybody is engaged from the start. They're all on board, and that is working out tremendously as well. So whichever model a practice decides to do, both have been positive in moving forward. So with that said, Bonnie, let me ask you, as far as, was enrollment simple once the program was explained to the patient and either the family or caregiver? What were their reactions from the start?
Well, yes. First of all, patients were very excited to hear about the program because they saw how it would be beneficial to themselves, but the family members really love it. And I'll tell you why. It's because sometimes, and I don't care what location you're in, and this has been my experience with having my own case management company, you have mom and dad located up in the Northeast, the son and daughter-in-law might be in the Northeast, and the mom is down in Florida and needs someone to look after their mom and dad. And so that contact on a monthly basis is really reassuring to them. I know I communicate routinely with family off island. I have a lady in stateside over in Atlanta. Her dad lives here, and his health condition and communication goes both ways, both through the portal, the private secure network we use for HIPAA compliance, and or phone calls. So we'll reach out to each other, the daughter and myself, regarding the patient's concern, and there's ways that we can do that to keep them. We want to catch things early. It's the object of the program. It's a preventative program that Medicare wants us to really focus on, and it's so helpful for the patient. So there are ways that helps the family members as well. And I guess another funny example I can think of very briefly is that I had a husband for family support. I had a 98-year-old a patient who was like in her 75, 78 range, and the husband was 98 years old. He was bedbound, and his wife really didn't understand the resources available to him. He had had hospice prior, but they did not want to keep him on it because he was surviving, which was nice. But after 6 months, he was discharged from hospice, and so she was getting no respite care for him. So I reached out on her behalf and got her husband hospice care once again because he did requalify. So now the wife is less stressed, and that's really why I addressed it initially, because she's our patient, and she was very stressed out and exhausted. So I think a lot of things happen out there that we can help with and makes the patient feel more comfortable. And that's, I think, what really drives why the patient loved the program, and it's such good PR for your practice.
Yeah, that is a great example, and I'd like to add that we are finding that on a national level that the patient's family members, when they hear about this, they are really excited because not only where you're located, but we do find that a lot of the Medicare patients perhaps are not living with their extended family any longer. So to be kept in the loop and advised, they didn't know this was even available to them. So really exciting that you're able to confirm what we're hearing, across the board from our clients as well.
Yeah, absolutely. And it wasn't just here. I mean, when I was having my own case management company back in the States, it's the same way. Our relatives don't always live near their aging population parents, and so it's reassuring to them to know that there's someone there that's professional and the practice is looking after them. So it's been really helpful.
And we also have heard from other practices that family members have come in and they've heard about it. This started in 2015, January. We're almost 2 years in, but it's still in its infancy if you look at the overall picture. But we are hearing that family members are going into other practices, and we're having some outreach where they're saying, I heard about this program and a practice in another county or some other area that they know people that are mentioning it. They're asking, is it available to them? So really a strong endorsement right there. Thank you for that example.
Sure.
So I'd like to, touch on right now, what is the immediate benefit that you noticed specifically to the patient, Bonnie?
I'd have to say it's better care coordination with their medications. You know, our Medicare population, depending on their educational level and their just their knowledge base, they get confused with their medications all the time. They're getting medications from, like I mentioned earlier, a urologist, a neurologist, another physician, an orthopedic physician maybe, and with this program, it helps us better coordinate their medications. And we know, as in the aging population, two things occur, two things that are primary causes of problems for the aging population, and that is mismanagement of medications and falls. So the management of the medications has been critical. We can keep track of the specialty referrals they see, update them often, talk to our physicians about when we see something new that hasn't been there before, and I think that's a real benefit.
Yeah, that is a great example, and we're hearing that same information as well across the entire client base. That is a significant problem, and chronic care management is looking to address that. Do you find that chronic care management has improved the patient-practice relationship?
Well, you know, our providers have always had a great relationship with the patient. This practice here is phenomenal. And most practices do have a good relationship with their patients, but it certainly enhances that it's more of a patient-centered care, and I think that the patient feels that it enhances that patient-centered care we already provide, and we receive great feedback about the program. Many patients live by themselves, as we talked about, and it's reassuring to have someone check on them at least on a monthly basis. So yeah, it's really improved the patient-practice relationship, because I had a patient the other day, as a matter of fact, she was seeing another family practitioner, a solo practitioner in town, and she came here and said, oh my gosh, I love the way you guys are always calling me and finding out about me, and I've just switched practices. So, and that actually happened just last night. I was talking to this patient at 5:30. So things like that happen frequently, and I think it's definitely improved the patient-practice relationship.
That's a great endorsement to the program. You mentioned that you are a dedicated care manager, Bonnie, but I'd like to ask you about the benefits of the program to other members of your staff.
Oh, yes. Well, there's lots of interface that happens between myself and the other staff. I don't care who's doing the program, whether it's one individual or several individuals within your practice. You're going to be able to interface with the nursing staff, our lab people that do our CLIA lab. It definitely increases communication. I'll talk to a provider every day if I know a patient isn't doing well via my phone interviews with them, find out if, you know, what's going on. There's a lot of collaboration in our practice. Because of this, I think it has enhanced that, and people are not so much in their silos. They're a little bit, you know, nursing is very easily talked to, so is the lab, so are the lab people, and it's just a good collaboration benefit, I think, to for the whole practice. And it really enhances not just the communication, but the patient's quality measures and positive outcomes, and I think that's really what the program is about. We want to drive revenue. That's important for our practice, but we also want to provide the best care we can. So it keeps the provider in tune with what's happening to the patient more readily. You know, many of our patients, as you know, in a family practice situation, they come back every 6 months, maybe annually, maybe every 3 months, depending on their condition. And so if something happens in between that time, we really don't know much about what happened unless they call us and make another appointment. So this is a great way to close that loop.
That's a great point, Bonnie. Thank you. The next few questions I really want to touch on more of a personal level of how chronic care management is received. Does it feel good knowing that you're helping others take better care of themselves, and would you be able to provide an example?
Probably. Yes, I think I can. You know, let's see. Yeah, it makes me feel wonderful. And here's an example. I had a patient the other day. The patient has diabetes. Her daughter came in with her, and her daughter is younger. She's only in her 40s or late 40s, and the daughter has diabetes as well. Well, when I spoke to the patient about the program after the provider enrolled them, I just wanted to give them a handout, give them my card, how to contact me if they need anything, tell them a care plan would be forthcoming. Both were very excited about the CCM program. They planned on doing it together. I had shared with them some dietary nutritional handouts regarding the low glycemic index, alongside setting up a fast walking program for them because they both needed to lose some weight. And the mom is eligible, the daughter isn't, but they're banding together to take better care of themselves and lose the weight together. And that's very, very satisfying to a provider and a caregiver, because you know you're making a difference. And I think that's the important thing.
That's great. And, you touched on the check-in calls. Do you look forward personally to the check-in calls and hearing that a patient, that you know that they are following the orders that and the conversation that you had touched on?
Absolutely. Now, do all of them do that? Absolutely not. We know in every practice there are always the people that just kind of want to go their own way. But, through education and through coaching and encouragement, I have seen some changes, which is very positive. So yeah, I look forward to the calls because I get a lot of great satisfaction out of it. And it's nice to share that with the providers as well about how well they're doing, or they've lost 4 pounds in a month and a half or something like that, and they're maybe borderline having diabetes or pre-diabetic, and we don't want to put them on medication yet. The provider does not. The patient doesn't want to go on medication. So those are the kind of things that are very fulfilling, I think.
Thank you. And following through on those 2 previous questions, Bonnie, have you seen an increase in well-being of the patient?
Yes, we have. We've seen a decrease in readmissions, and in fact, I can't recall one readmission we've had since we've started the program, and that just might be a coincidence. Definitely there have been a few ER visits, but really very few. And that's important. Your ER visits are down. You're preventing readmissions and hospital stays. So I think that's the name of the game for the well-being of the patient.
That's very exciting. Thank you, Bonnie. Last question for today. Are patient visits more thorough? Do you find that they're better informed about their health?
Yes. There's no question about this. I think most people who are in healthcare are educators, no matter what you do, whether you're a provider. And we know the providers don't have a lot of time when they see the patient to educate. And the nursing staff is usually, or the MAs are usually very busy, so they don't have time either. But anytime we can give the patient additional information and education, I'm a firm believer in that. They have patient, I could tell you a story about a patient didn't want to take a statin drug that for their cholesterol that one of the physicians recommended. And, they had heard bad things about it. And I said, well, tell me what you heard. And they said, well, I've heard about this, and, it can create aches and pains. And I said, well, I guess you have a choice as a patient. You can not take it to avoid your aches and pains, but you can possibly be setting yourself up for a stroke or a heart attack or something much more invasive that is a lot more detrimental to your health than aches and pains. So in a nutshell, I think simple things such as telling them how to eat better, to exercise, and I'm a firm believer in closing, I just want to say I'm a firm believer in patients being in control of their own care, and I think this CCM program helps educate them to make the most informed decisions possible for themselves, and that's all we can ask.
Well, thank you again, Bonnie, for that very informative practice perspective. I think now would be a good time to turn it over to Jameson, see if there's any questions for Bonnie or myself.
Thanks, Michael. And there have been some questions that have come in throughout the course of the webinar here. One of the first ones I can answer, it was, can we have a copy of the slides to print out? And the answer to that is yes, we are recording this webinar, and we'll also send a copy of the presentation slides to everyone who registered once we finish the live broadcast. Other questions I've seen, Michael, have been on the codes that you mentioned, specifically the G0506 code. Two questions on that. Is this a face-to-face code, and then can that be billed along with an EM code at the same visit?
Yes, and that is a one-time code. So previously, when a patient comes in and you're talking about the chronic care management program to have them consent into the program, that was an activity that had to be done. So yes, that would be an add-on code in addition to an EM visit. And so yes, you can do that. What was the first part of the question again, Jameson?
Is this a face-to-face code?
Yes, it is. That would have to be face-to-face. It has to be done while the patient is physically in the office. It would have to be discussed, going over the same information that is required, advise the patient of the what is going to be benefiting them with regard to the chronic care management program. We have that information that we provide to each practice, so they're able to go down the list, discuss those as well, and doing an assessment, and you would have to be going over the diagnoses and care plan with the patient while they are physically in the office. The creation of the actual care plan, once that discussion has taken place, that could be done as well face-to-face and or non-face-to-face.
Now, if I may interject something too, this is a huge benefit for our practice. You know, our physicians and the providers here, the mid-level providers, take the time to touch base with the patient about this. And now, actually, I call it double dipping. It's great. We can go ahead and get paid for the office visit, and we also can get paid for enrolling them in chronic care management. So that is a huge benefit. Once again, I really am excited about this because it validates to me how dedicated Medicare is to making this program work and making it easier for the practices.
And this code just got finalized within the previous few weeks, so many practices are not aware that this is taking effect.
Great. And the next question we had was, you had talked a little bit about if you don't have a dedicated chronic care manager in your practice, you can take a team approach. What the question is, are there specific qualifications required for clinical staff to manage this program?
Yeah, so CMS does have certified clinical staff. So that can be obviously the main providers, nurses, a licensed clinical social worker, a certified medical assistant, or a CNA. So that is what CMS is requiring for certified clinical staff, whose time would count and be billable towards the 20 or more minutes in a calendar month.
Great. The next question, Bonnie had mentioned she had some materials in the office to kind of introduce the program to patients. Is there any examples that our attendees here today can have, either from CareMerge or Amazing Charts, or Bonnie herself, that would just give an example of what this type of material looks like?
Yeah, I'm not. Michael, I can't recall. Did you all develop this for our practice? I think we put it together ourselves.
Yep. Well, we do provide to all practices the consent form, which lists what a provider will be addressing and what a patient can expect. We do that for every practice. We also provide a brochure on chronic care management to help educate the patient on what the program is. Because let's face it, most patients, when you speak to them, they've never heard of it before. So if you have something in addition, Bonnie, that you have, but we do supply that to all practices, the consent form, the information, and a brochure as well.
Right. Yeah, the agreement or the consent form. What we provide, if someone was asking, is we just did one little pager with little red lettering on the top with the practice logo. Welcome Medicare patients to our chronic care management program. Our goals for you, what is the CCM program and how you can sign up. Keep it really simple. And we attach this to the charts. And then, like I said, the nurses, when they room the, or the MAs, CNAs, when they room the patients, they just hand that to them. Say, I know you're not signed up yet, but here's some information. And when the provider comes in, they'll discuss it with you. So they have time to read it, which is good. And it's not very long. It's like literally 10 bullet points. So keep it simple, but it's something like that is real easy to develop internally.
Great. And I have about 2 or 3 more questions that we can address today. One of them is, you've described how this works for a large practice with lots of staff. How would this program work for a small practice with a single MD?
So with a single MD with no other staff, obviously the time that would count is solely lying on that one individual. So if this individual, let's say the MD in the question that was presented, any of the forms that they fill out, the phone calls that they are doing all on their own, that is the time that would count. There is no other staff to add to that time, so if that staff member is finding they are expending those activities, which I'm positive they are on a daily basis, then they would be documenting the information themselves in our platform, which is very easy to use and efficient.
Yeah, just to add to that too, and it's a great question, because there are so many templates that are already existing for lab review, medication review. You literally click in the application and it documents it for you, and all you have to do is plug in how many minutes you spent on that patient. Say you were reviewing their labs with them on the phone, a physician was, or an MA. I'm sorry, a CNA. MAs are not covered under the program, but just CNAs, certified nursing assistants, RNs, LPNs, social workers, as Mike said. But it's so easy for the provider. They don't have to type anything. They literally just, if you want to adjust your template in the initial beginning, and then the provider just has to go in, click on it, and document the time, and it's that easy. So it's very doable with one or two providers.
Great. And the last question I have here is it possible to have a look at this Care Merge program?
Absolutely. You could reach out to one of your Amazing Charts account managers to schedule a demo. They will walk you through the program and be able to address any questions with regard to the chronic care management program itself.
Great. And so if we didn't address any of your questions that you submitted live during the webinar, we will be sure to follow up individually. And with that, I will hand it back to Michael to close out.
Thank you, Jameson, and thank you everyone for your time in joining the webinar today. And I really want to express thanks for Bonnie taking the time out of her busy day. She's covering 3 practices, and this is really a follow-up to one of the previous webinars that we did, where Bonnie was on and said, if you're ever in need of another physician or practice perspective, and that's where this idea came into being. So I just really want to thank her again for her time and willingness to participate on this program to address and bring forward the main points of the chronic care management program itself, how it could be implemented easily, and the success that really is ensuing.
You're welcome, Michael. Enjoyed it. Always good to share good things.
I'm sure it was very beneficial to the practices that were present on the webinar. Thank you again.